Hello all. We will have a quick review on the NCLEX RN questions. First question. The ambulatory care nurse is discussing pre-operative procedure with a Japanese American client who is scheduled for surgery the following week. During the discussion, the client continuously smiles and nods the head. How should the nurse interpret non-verbal behavior? The options are: first, reflecting a cultural value; second, an acceptance of the treatment; third, client agreement to the required procedure; fourth, client understanding of the preoperative procedure. So the option 1 is correct. Nodding or smiling by a Japanese American client may reflect only the cultural value of interpersonal harmony. This nonverbal behavior may not be accepted or acceptance of the treatment by the client, agreement with the speaker, or understanding of the procedure. Question 2. When communicating with a client who speaks a different language, which best practice should the nurse implement? Speak loudly and slowly. Arrange for an interpreter to translate. Speak to the client and family together. Stand close to the client and speak loudly. What is the option according to you? Option 2 is correct, as arranging for an interpreter would be the best practice when communicating with a client who speaks a different language. Option 1 and 2 are inappropriate and are ineffective ways to communicate, whereas option 3 is inappropriate because it violates the privacy and does not ensure the correct translation. The question 3. The nurse educator is providing in-service education to the nursing staff regarding the transcultural nursing care. A staff member asked the nurse educator to describe the concept of acculturation. The nurse educator should make which most appropriate response? Option 1. It is a process of learning a different culture to adopt to a new or changing environment. Option 2. It is a subjective perspective of the person's heritage and a sense of belonging to a group. Option 3. It is a group of individuals in a society who are culturally distinct and have a unique identity. Whereas option 4, it is a group that shares some of the characteristics of the larger population group of which it is a part. Hence, the option 1 is correct. Acculturation is a process of learning a different culture to adapt to a new or changing environment, whereas option 2 describes ethnic identity, option 3 describes an ethnic group, option 4 describes a subculture. Question 4. The nurse is providing discharge instructions to a Chinese American client regarding prescribed dietary modifications. During the teaching session, the client continuously turns away from the nurse. The nurse should implement which best action? Here we need to focus on the question which is mentioning best action. Okay, so option 1, continue with the instructions verifying client understanding. Option 2, walk around the client so that the nurse constantly faces the client. Option 3, give the client a dietary booklet and return later to continue the instructions. Option 4, tell the client about the importance of the instructions for the maintenance of health care. Option 1 is the best action. Most Chinese Americans maintain a formal distance with others, which is a form of respect, okay? Many Chinese Americans are uncomfortable with face-to-face communication, especially when there is eye contact. If the client turns away from the nurse during a conversation, the action is to continue with the conversation, walking around the client so that the nurse faces the client is in a direct conflict with the cultural practices, the client may consider it as a rude gesture if the nurse leave him or her and return back later to continue the explanation. Okay, so remember always that to continue the conversations, especially with the Chinese patients, without holding the conversation. Question 6. Which client has a high risk of obesity and diabetes mellitus? Select all that applies. Option 1. 40 years old Latino American man. Option 2. A 45-year-old Native American man. Option 3. A 23-year-old Asian American woman. Option 4. A 35-year-old Hispanic American man. Option 5. A 40-year-old African American woman. So option 1, 2, 4 and 5 are correct because of their health and dietary practices. Native American, Latino American, Hispanic Americans and African Americans have a high risk for obesity and diabetes mellitus. Asian Americans have a low risk for obesity and diabetes mellitus.